Histologically, lymph nodes consist of several functional subunits separated by septa, tuberculi. Each functional subunit can be further divided into the capsule, cortex, marginal sinus, cortical nodules, follicles, germinal center, paracortical zone, T-cell zone, and medulla, medullary sinus and medullary cords. Foreign antigens and blood reach the lymph nodes via afferent lymphatic vessels and arteries and flow out again through efferent lymphatic vessels and veins. As part of the primary response to an infection, antigens are presented in the lymph nodes after they have reached the marginal sinus via the arteries and afferent lymphatics. In the marginal sinus, antigens and the factors C3b and C3dG of the complement system are bound to the membrane by macrophages. 1. The macrophages that live here express only small amounts of lysosomal enzymes and accordingly only slightly decompose the antigens. As a result, the B lymphocytes, CD20, located between the follicles receive their specific antigens and bind them via their B cell receptor, BCR2. Activated B lymphocytes are then chemotaxed into the follicles by the CXCL13 produced by dendritic cells and in turn transfer the bound antigens to resident dendritic cells, 3. The dendritic cells of the follicles in turn activate the T lymphocytes, CD3, located in the paracortical zone via their TCR, 4. Until then, the T lymphocytes are chemotaxed locally by the anti-apoptotic CCL19 and CCL21 formed by resident dendritic cells. However, the activated T lymphocytes now form CXCR5 in order to migrate back into the follicles, 5, where they activate the B lymphocytes and allow them to differentiate into plasma cells, 6. Plasma cells and activated T lymphocytes leave the lymph node via the medullary sinuses and efferent lymphatic vessels, as well as veins, to circulate in the peripheral blood, 7.